Hello, everyone. Thank you for joining us on this episode of BAEP Talks with a 30-minute discussion with a person of interest who has experience with living with, managing, treating, and/or supporting others with a chronic menstrual health disorder. My name is Shantae Warden, the Vice President of the Barbados Association of Endometriosis and P.C.O.S. Now, today I am joined by Victoria Cox, a Canadian-trained registered dietitian who works both in private practice and as a consultant for the Maria Holder Diabetes Center and part-time instructor at the University of the Southern Caribbean. Victoria works with adults and children and has a passion for helping others develop a healthy relationship with food while using medical nutrition therapy as a means to promote health and prevent and manage disease. Victoria enjoys focusing on the fun side of nutrition, eating healthy foods that actually taste amazing, and developing sustainable lifestyle patterns that do not incite feelings of over restriction. Welcome, Victoria.
Hi, thank you so much. I'm very excited to be here.
Yes, I'm excited for our discussion today. So my first question to you, Victoria, would be, what made you decide to become a dietitian?
Every time somebody asks me this, I wish I had some like epic origin story, and it was sort of something that I went into a little bit on a whim. And I remember when I was in nutrition, there being other women in the class who were like, oh, I've wanted to be a dietitian since I was 12. And I was like, at 12, I didn't know what a dietitian was. But it was really just a combination of, I was, always interested in sciences and health sciences, but I didn't sort of have that urge of, I want to go into medicine or like be a doctor, which you kind of, I guess, when you're younger, you sort of have a very narrow view of what opportunities are out there for careers. Anyways, but I, had a love for health sciences, and I had a love for food, eating it, cooking it, baking it, all the above. So I just started to look into different avenues, really, chose nutrition and dietetics kind of on a leap of faith. And I'm very happy that it turned out the way it did, because I love my career path. So.
Okay, that is so great. I like that you said you like food, because
yes.
I know people, when we think of nutrition, we always think of it, when we say healthy, we think of it as something that wouldn't taste good. So I like that you're trying to have persons associate eating healthy with actually tasty meals that they can enjoy. So my next question to you would be, what is the difference between a dietitian and a nutritionist?
So, I mean, technically, the answer to that question will vary a little bit depending on where you are. So, like where I would have studied in Nova Scotia, I don't think nutritionist is a protected title. So it was sort of like anybody would be able to call themselves a nutritionist. It doesn't really reflect on if they have any training or not. In Barbados, to the best of my knowledge, we do have registered nutritionists in Barbados, which would mean it's somebody with an undergraduate degree in nutrition who's registered with the Paramedical Professions Council, and then so registered dietitians. The main difference would really be you'd find that most dietitians would then maybe have gone on to do a master's. But I guess the key difference really is that we would have done a dietetic internship, after which, you take an exam, you register with a regulatory body. So I'm registered with a Canadian body, which, holds me accountable to continuing education, proving continuing competence, that sort of thing, which is a good push to make sure that, I stay on top of best practices, ongoing research, and things like that.
Okay, wonderful. A lot of times some doctors, or maybe let's say fitness persons, trainers, may say, okay, you need to change your diet, you need to change what you eat, what you intake in order to be, I guess, more healthy. So how do you exactly work with the medical practitioners, fitness instructors, or trainers in developing individualized plans or treatments for persons?
Yeah, so it looks like a little bit different depending on their reason for referral, I guess. But I have made a point since I've been back in Barbados to try as much as possible to network with different members of the medical professions, so different doctors and fitness individuals as well, because I do think it does make such a big difference when you're able to work with somebody as part of kind of that like multidisciplinary team. Like it honestly, it really does improve outcomes regardless of kind of the reason that somebody is needing help and support. And so, there's different doctors who, for example, they've got like my little referral pad. So they'll kind of refer patients to me and kind of give me some of the history and reason for referral. So then I'm informed by, the doctor. So I'm able to know, okay, are you on medications? What are any specific goals that you and your doctor are working on? Because that can then influence the recommendations that I would make nutritionally. And then I would update the doctor in terms of, okay, this is how the initial consultation went. These are the things that we're going to be focusing on. Because I think it just makes sense, doesn't it? You think if you're trying to support somebody's health overall, working with our doctor is obviously a huge part of that. But if it is a condition where a lifestyle intervention like healthy eating can, make a difference, and there are many examples where it could make a huge difference, I think it just makes sense for, us to kind of all be on the same team, because, if we're following that idea of client-centered care, it's really about trying to have the best outcome for the client or the patient, right? So that's how I'll sort of work with doctors, trying as much as possible for us to all be on the same page. And I guess it, is similar with like fitness trainers and stuff. There are definitely some amazing personal trainers who will kind of reach out to me and say, okay, they might have provided some kind of basic healthy eating suggestions to their clients, but then they feel like whether there's maybe a specific medical condition or just kind of goals that go above and beyond what they feel is in their scope, they'll kind of explain that to me and again, sort of refer the client to me, which I think it's a nice back and forth, because it's the same thing that I would do in, like, people ask me all the time, what about exercise? What should I be doing? And I think it's not my scope, like, because a diet and exercise are so closely linked in our minds, I guess. Understandably, yeah, people will ask me about what kind of exercise they should be doing. And above and beyond the bare basics of, if somebody is medically cared to exercise, I'll always advocate for the fact that it's probably a good idea to try and incorporate it. It's got lots of benefits, but I am not a personal trainer. I'm not an exercise physiologist. So it's nice to see that back and forth when, like I said, we've got some great trainers in Barbados who will do the same. They'll kind of be like, listen, I'm not a dietitian. I'm not a nutritionist. So why don't you go and see how Victoria or whomever, can help. And then we just sort of work together in theory, to, really improve outcomes as best as possible. So it's a lot easier when everyone's on the same page versus when someone is, because you get a lot of conflicting information, right? So if, like a trainer is giving one set of advice and then someone on their own decides to go see a nutritionist without the trainer and the nutritionist kind of being on the same page, they might be giving conflicting information, which is a huge part of confusion that we all kind of deal with. We're inundated with information all the time, and we tend to hear like, well, this person says do this and this person says do the complete opposite, and we're like, so being on the same page, I think is I really enjoy that kind of teamwork.
Yeah, that is true. And I like the fact that you mentioned a multidisciplinary approach, because now we're finding that specialists are saying we need to come together. So let's say for a condition like endometriosis, we can't only look at it from a gynecological part. We have to look at it psychologically, we have to look at it nutritionally, all these different aspects. So it's good to have that team in order to help you as the patient to have a better life, a better outcome overall with your health.
Exactly.
Okay, so I know we hear a lot about diet and having a balanced diet. What would you say is a balanced diet?
Oh, I got a really cheesy prop for this. I forgot I had it. I brought it from my office. So a balanced diet, this is where I usually tell people, I'll sort of warn them that I'm going to get into the boring stuff, the kind of like I could feel them rolling their eyes at me, as I'm about to go into what does a balanced diet look like. But I think because we do tend to hear so much conflicting information. As much as looking at what a balanced diet is seems like really basic information, it's almost like we forget what it does look like, because like I said, there's so many diets that you think, okay, well, this person is, this person is vegan and they're totally plant-based, and then that person eats tons of meat and they're eating a ketogenic diet, and that person is eating every 2 hours, and then the next person is intermittent fasting, and you're literally like, oh my gosh, you're all just doing complete 180s. And so then I see a lot of people who feel kind of overwhelmed, understandably, and so as if they second guess that they know what a balanced diet looks like. So my like foundational thing of what a balanced diet looks like, and here's my cheesy prop. It's my little plate here.
Yeah.
It's what I'll usually call the 1, 2, 3 approach. So I'm saying, like, in the most basic sense of the term, a meal is nutritionally balanced for the most part if it's got starch, protein, and vegetables, right? Like, kind of keep it super basic and then build on that, because obviously people could argue, okay, so I just need starch, protein, and a veg. So it could be French fries, fried chicken, and coleslaw, and that could be my perfectly balanced meal. And so technically by that definition, it's balanced. It's just not necessarily the most nutritious. So I might take it a step further and say, okay, well, we want it to be preferably like a high fiber starch or a minimally processed starch, could be sweet potato or rice and peas. We want a lean protein, so preferably something that's not fried or not like a really salty processed protein. And then just usually I would say a variety of maybe differently colored vegetables or fruits, depending on the meal, right? Breakfast, for example. So that's kind of my concept, I guess, of a balanced diet. And oftentimes, in a really basic sense, I would just be saying, if you're feeling overwhelmed, make a mental list of, okay, here are the high fiber starches that I like, here are the lean proteins I like, the veggies that I like, and you just pick one thing from each category, pull them together. It doesn't matter if it's like a trendy Instagram worthy kind of meal. You've covered your bases of your 1, 2, 3, right? Kind of keep it simple.
Yes, I like that idea. I like that idea of listing what you prefer. Because everybody doesn't prefer the same things.
For sure.
And then making up your own meal plan.
Yeah.
Basically.
Exactly.
That makes it more enjoyable instead of having to think, oh my God, what am I going to eat that is healthy for me?
Yeah.
Because a lot of times we think healthy, we think it tastes not so good.
Yeah, or you think like healthy, that it has to be like a really specific thing that's not what you're already doing or what you already like. Like I often feel like, I'll kind of put it in that, especially, the internet and social media and stuff. It can kind of make it seem like healthy eating is this very specific box. Like, this is what healthy eating looks like, as opposed to I'm kind of like, okay, well, that might be social media's version, but like, if this is you, we're working with how to just make some healthy changes within your own box, right? Like, it's not that you have to completely switch, because people will get sort of overwhelmed. They'll be like, oh, I follow all these pages that say, the people on the pages eat a ton of avocado. I hate avocado. I'll never get to eat healthily, because there's like that misalignment of things they see as being healthy and what they like or what they know. Yeah.
Okay, so I heard you talking about diets. And for me, I've heard of all these different types of diets. There's the keto, the Atkins. Recently, I heard about the Mediterranean diet, the intermittent fasting, as you mentioned, and the anti-inflammatory diet, just to name a bit.
Yeah.
Are there pros and cons to these diets that people tend to go on?
Yes. Oh, yes. So, I mean, there's pros and cons to any diet. And I think, the examples that you sort of listed range a lot in their flexibility. So, for example, something like a ketogenic diet is a very specific pattern of eating, in that, there are essentially rules around, you have to eat a very specific proportion of calories from fat versus protein and carbohydrate to put yourself into this metabolic state of ketosis, as opposed to something like the Mediterranean diet, which I would consider have a lot more fluidity to it. It's kind of just based kind of key principles, you know what I mean? And actually, I think that there's Mediterranean diet is kind of one of those things that stands out in I feel like any nutrition professional or somebody who's been a nutrition student, you always hear a million things about the Mediterranean diet because it comes up in research all the time. And I'll maybe touch on it later, depending on how the conversation kind of goes. But in terms of pros and cons of different diets, I think the more restrictive a diet is, or the more rules a diet has, obviously, the more you're going to get into possibly the cons side of things. I mean, at the end of the day, obviously, it all depends on why somebody is going on a specific diet or pattern of eating. Because, of course, I don't want to discount the fact that there are people medically who have to eat very restrictive diets, patients on dialysis, for example, like it's not necessarily a choice. So when I say avoid restrictive diets, I'm not referring to people who are medically indicated, listen, if I don't eat this way, it's not going to go well. But, for a large portion of people who kind of put themselves on a really strict diet, I think that in and of itself is tricky in the long run or not sustainable, because anything where there's too many rules and you feel that you're having to cut out too many of your favorite foods, chances are, I mean, everybody kind of knows this, right? You're not necessarily going to follow that diet forever, are you, if it's restricting all of your favorite foods? I saw something, I can't remember what it was. So a friend of mine shared it on Instagram. I think it was a different dietitian had made this quote, and she was just saying, shut your eyes and imagine yourself eating a meal 10 years from now. What does that meal look like? And I guess it was trying to emphasize, like, if you're putting all this time, effort, stress into following a specific diet right now, but in 10 years from now, that's certainly not what you see yourself eating. Yeah, it's like, is it even worth it in the moment? And are there just other changes that you can make? So I feel like I definitely we say the word diet all the time because it's just what comes up naturally in conversation, but I try and avoid the idea of going on a diet versus just like, okay, we can pull, because we like to label things, but we can pull concepts from different diets, right, that are healthy, that will work for that specific person for specific reasons. So like pull from things that would fall under the Mediterranean diet and pull from other things, because a lot of them, like I said, will have pros to them as well. Even the diets that are maybe not ones that I necessarily advocate for, you can find you can almost always find something positive in any kind of diet, right? If it promotes fruits and veggies, there's already one tick for whatever diet that might be,
Yeah. Okay, so when persons are choosing to go on these diets, would you say that their body mass index should be taken into consideration?
It's an interesting question. And it's funny because I do some teaching, and we just last week covered BMI, or this week, I can't remember, and we were talking about pros and cons of the BMI, and kind of, because all it really is, I mean, it's just weight over height squared. So I feel like people will refer to it as for my height I should weigh this much. And I think in terms of someone deciding or having BMI be a deciding factor in their diet, I think that's a really, really small piece of a lot of information that is maybe needed to determine why someone should or should not make changes to the way that they eat. It's not like I'm discounting the usefulness of BMI as a whole. I think, for like research purposes or like on a population level scale, it gives you useful information. But I was thinking about it as far as determining if someone is healthy or not, or what a way that someone should eat. And just using myself as a very personal example, I had to go to the doctor 2 weeks ago for like a general physical. It was like an insurance thing, and so they took my weight, and I could see what my weight was and sort of do the math, and I was like, my BMI puts me as overweight. So I guess just in my own mind and thinking about, okay, so on paper, whoever is reading this but maybe doesn't know much about me, they see, oh yeah, tick off, she's overweight, which automatically kind of puts me in this category or this box. But I don't necessarily think that speaks to how healthy or unhealthy I am at all, really. I mean, I try and eat healthy most of the time. I would consider myself a fairly healthy eater, and I'm a physically active person. And so I feel like it's a really small piece of the puzzle. I'm not saying it's completely irrelevant. And interestingly enough, I kind of made a joke to the doctor about, oh, I see my BMI being overweight. I just made a comment, and he was sort of like, yeah, well, I'm more interested in your waist circumference anyways. You know, which but that is, you know, and I could see that is totally relevant from the point of view that at least it's this acknowledgement that BMI is not the be all end all, you know, by any means. And there are other measures and not just legitimate measures, but other factors to consider in an assessment that's going to give us an indication of someone's risk for certain conditions or overall health status. And I would agree with him in that waist circumference is probably more predictive of you know, risk for certain conditions than BMI, because like we all know really buff athletes who are all going to be obese according to their BMI but have like hardly any body fat, right? It's just that they have a lot of lean muscle. So I kind of went on a rant there, sorry.
No problem. You just answered my next question. I was gonna ask you about the BMI determining the person's health. So you just answered that, and as you said, the BMI should not be the only factor in trying to figure out if somebody is healthy. We should take other things into consideration, right?
Absolutely, lots of things to take into consideration. Yeah, a lot goes into that, I feel.
Okay, so do you see patients with endometriosis or PCOS?
Yeah, so I would definitely say I see a lot more women who've been diagnosed with PCOS than I do, or than I have seen women with endometriosis. So it would be sort of a small, like I can think of them immediately off the top of my head. The women with endometriosis is in reality for me not been that many. So I don't know kind of what the experience has been for other dietitians and nutritionists in Barbados. But definitely in terms of PCOS, the interesting thing is, and I don't know the statistics off the top of my head, you know, I'm sure you would know them better than I for sure, but in terms of diagnosis rates and stuff, particularly in Barbados, but PCOS wasn't even really something that I feel was talked about when I was a student. Like it wasn't a topic that was covered per se. I've had to do sort of since I was a student from then until now, I've done obviously a lot of continuing education, and each year we sort of have to pick areas of focus for, so just as part of our continuing competence program, we have to pick areas of focus that we're prioritizing for continued learning. And I have previously chosen PCOS kind of on an ongoing basis, just because considering that it's something that wasn't really talked about when I was a student, I'm seeing anecdotally, in my opinion, many more women coming forward who are diagnosed with PCOS. And oftentimes when I see them, it's pretty hit or miss whether they're seeing me and they're referred because of their PCOS diagnosis, or oftentimes they're just kind of choosing to come to me or coming to me for a different reason. But then it comes out that they're like, oh yeah, by the way, my doctor diagnosed me with PCOS a few years ago, or something like that. So it's not even always that I know upfront that that's somebody's reason for coming, but I definitely feel like I can confidently say for myself that I'm seeing a lot more women recently, since I've been home, that have been diagnosed with PCOS and are interested in trying to figure out what, you know, like what diet, what kind of lifestyle changes can be maybe made or incorporated to help with the management.
Okay. I'm thinking when you said that you're seeing more PCOS, people with PCOS, I'm thinking because there's this relation between PCOS and being overweight. Now people automatically assume overweight means that you're unhealthy, so maybe you need to change your diet. But question, are any of your patients, because I know there's some women who have PCOS who are not overweight, who are lean.
Yes.
So
I have, yep, I have. I would say the majority, and you're totally correct in that. Right, there is this a strong association between women with PCOS being in that kind of overweight category according to their BMI. and having difficulty losing weight. And obviously there's so much that goes into that we are now figuring out more and more kind of the underlying reasons why these women have difficulty losing weight or experience weight gain. But I have had women with lean PCOS, so who have been diagnosed with PCOS. I've had underweight women with PCOS. So it's not as common in my experience. So just anecdotally speaking, the majority of the women that I have seen with PCOS would have like been considered, overweight. And like a lot of times, especially for self-referrals, the reality is a lot of times when it's not coming from a doctor or somebody else, and somebody just decides to see me because they want to, a lot of times it is related to weight management goals, or just sometimes it might just be like frustration with, could be like menstrual cycles or trying to conceive and stuff like that. But definitely, yes, I have seen the lean PCOS women, but certainly more of them do tend to present being in a place with wanting to lose weight.
Okay. So would you say there are nutritional guidelines for persons living with PCOS? What would those guidelines be?
Yeah, so definitely, I mean, there is an impressive amount of research that kind of does show how different dietary strategies can help, or there's a lot of room for it to help women with PCOS. And again, it will kind of all depend on the specific women in terms of if they have, information, for example, on is there insulin resistance? Has their, medically speaking, has their maybe doctor confirmed the presence of insulin resistance? I mean, I feel like maybe the statistics vary, but I know like off the top of my head, I feel like I've seen, maybe up to 70% of women with PCOS have some degree of insulin resistance, which is then tied to some of the other, kind of like increased androgen levels. So other kind of hormonal imbalances, I guess, which all kind of tie into their symptoms and their experiences. So as far as dietary strategies for that, I would say a lot of them probably do circle around this idea, well, okay, if there's insulin resistance, then there's definitely strategies of eating that have been found to lower, circulating insulin levels, and improve blood sugar levels and things like that, because women with PCOS are at increased risk for diabetes, for developing diabetes. So, talking a lot about, in that sense, maybe focusing on things like carbohydrates. I've heard obviously like the stuff online and stuff in terms of women maybe thinking, okay, if I have PCOS, I have to follow a low carb diet, or obviously the other one that goes around a lot is that they have to follow like gluten-free, dairy-free. I feel like there's one other free, I can't remember, but this idea that, okay, they have to do these specific things. And the reality is, in most cases, that's not the case. But I would talk a lot about carbohydrates more in terms of, okay, well, looking at meals and patterns of eating and foods that are not going to, really cause or like a really drastic increase or spike in blood sugar that's then going to trigger this big release of insulin, because we're trying to ultimately result in lower circulating insulin levels. So looking at, portions of carbohydrate and definitely quality of carbohydrate. There's quite a lot of research looking at like the low glycemic index diet for women with PCOS being able to improve ultimately some of these hormone levels and these like signs of insulin resistance. So that would be, I guess, one way I've heard people put it across is it's slow carb as opposed to low carb. So it's carbohydrates that kind of do a nice slow release in terms of increase in blood sugar rather than like a spike in increase in blood sugar. Which, I feel like in Barbados, the most classic example ever of the glycemic index that everybody knows is English potato versus sweet potato. Everybody talks, yeah. Because I feel like if you've ever spoken to somebody living with diabetes, they'll almost always say that they don't eat English potato, they eat sweet potato instead. So that, would be a higher fiber, lower glycemic index carbohydrate. So focusing, like I said, on that kind of idea of, okay, well, insulin resistance and carbohydrates would be a big part of the conversation. But obviously there's a lot more to it as well, just in terms of an overall I don't know, healthy, high quality, nutritious pattern of eating in that, it's also not uncommon, according to the research, to see increased inflammatory markers in women with PCOS. So, right, higher levels of kind of inflammation. And okay, well, thinking, what does that mean from a dietary perspective? Eating mostly minimally processed or unprocessed foods, I guess, where like the Mediterranean diet or pattern of eating kind of comes in, because that could be overall considered a high fiber, kind of antioxidant rich, so sort of anti-inflammatory, minimally processed pattern of eating. And as much as I say that I don't promote any one specific diet, I think the Mediterranean diet, if I had to pick one, the Mediterranean diet would probably be it. Because like I said, it's not as rigid and structured. It's more about prioritize these foods and minimize these foods, as opposed to you can only eat these and never eat these, right? Which it's not a way to, it's not fun. So, getting in things like your healthy fats, like your omega-3s, some olive oil, fatty fish, avocado, plant-based proteins, again, like really high fiber foods. So that would kind of be, like I said, have this overall improvement in terms of inflammatory markers, while minimizing, the highly processed foods high in lots of added sugars and saturated and trans fats and things like that. And I feel like I am always very careful in my language as far as minimize versus cut out. Yeah.
Okay, so you mentioned for the PCOS, trying to minimize the high glycemic foods. With endometriosis, I know a lot of times we're told you have to cut out gluten, dairy, red meats, alcohol, caffeine, all of these things. So would you say the nutritional guidelines for persons living with endo is a bit different than persons living with PCOS?
Yes, I would agree with that. I would say that. And I think, the reality is it's still going to vary a lot in terms of, I'm sure, not every woman with endometriosis is going to find improvement by cutting out gluten or cutting out certain things. But I know that there was that, like, it was like one main study that found like it was like a really high percentage of women felt so much better, or had such an improvement in symptoms when they cut out gluten. And it's always kind of one of those things where if cutting out something like gluten results in somebody having an improvement in symptoms, then absolutely it is worth pursuing. But it's also one of those things that, unfortunately, it's pretty rare that these things are totally cut and dry. And so because with cutting out certain food groups, there's also risks that come along with that, because there's plenty of healthy nutrients that we tend to get from gluten containing foods. They like, different, could be B vitamins or whatever. And so it's not like we want to be cutting out things on a whim if we don't have to. But that is one that, you'll see come up a lot, is possibly exploring cutting out gluten and seeing association between possibly high red meat intake and endometriosis. So I know that's something to consider. And then kind of the same idea of, a similar component to the PCOS in that, trying to get in this high fiber, antioxidant rich kind of overall pattern of eating. And then just, I'm sort of looking out for other signs, like, because could any of the symptoms, if they're sort of GI related, be related to like irritable bowel syndrome, for example? Because sometimes you might see a little bit of overlap or linkages there, and there are definitely, key food groups. It's an acronym, but there's like a food group called FODMAPs, which can be hugely triggering in terms of gas, bloating, diarrhea for people with IBS. So kind of think, okay, well, could that be part of it? Because that's a dietary avenue you can sort of go down. But I think, as frustrating as it is, and I get that it's frustrating, there is always this, like, because we just want to know, it'd be so nice, wouldn't it, if we could just, okay, well, if we did this exact thing, cut out these specific things, that things would massively improve. But there is always, or in many cases, going to be that little bit of trial and error. So you're kind of, based on what research has found and based on correlations, you're kind of then looking to see, okay, does that link apply to me and how I, when I do or don't do certain things with my eating?
So it's
Yeah.
always right over my mouth. Trial and error is very common
Yeah.
when doing these things. And I like the fact that you're still including, not really cutting out, as you said, you use the word minimize,
Yeah.
because we still need, as you said, a balanced diet. We need to have the starch, we need to have the main proteins,
Yeah.
and some diets do not allow you to have certain things
Yep.
that your body may need.
Yeah.
So I really
Exactly.
like that. That is your emphasis, and also um, being able to choose what you like to
Mhm.
eat
Yeah.
to make up this balanced meal and not having it seem as though, oh my gosh, eating healthy is such a
Miserable.
task and miserable.
Yeah, for sure.
So I want to thank you, Victoria, for coming on tonight with us. Um, I know that everybody's going to enjoy this session for sure, for sure. And I'm glad that you are making a change, associating eating healthy with a fun situation, not really making it something, as you said, as like that it's miserable. So I want
Yeah.
to thank you for coming on tonight.
Oh, thank you so much. This was so fun. I really enjoy talking about this kind of stuff. And I really appreciate everything that you guys are doing as well. So I think it's great, all the advocacy and everything. So I'm just glad that I got to be part of it.
Yeah, absolutely. We welcome you anytime. Anytime you're welcome. So
Thank you.
thank you guys. Thank you guys for joining us this evening on BAEP Talks with, and we'll see you next time. Bye.